All right, has everyone seen their group presentation dates on Blackboard? Yeah, anyone else taking a look at Blackboard, received notification, okay. So all your dates, presentation dates are on there, so hopefully you'll be ready. Group one, we're looking good.
Oh, wait, okay, yeah, Wednesday, like we said, next
Yeah.
week, yeah.
What are your thoughts?
Oh, yeah, I think we'd be able to still do it. Have you been brainstorming topics? I think we just need to agree on what we.
I haven't opened it on Blackboard.
Okay. Well, take a look, right? So we're looking at a functional behavioral assessment, right?
Yes.
So essentially you're gonna pick somebody, either somebody in the group or someone you know, someone willing to participate to talk about an undesirable behavior that they have, and kind of go through a systematic process of discovering how the behavior happens, what are conditions, what happen, antecedents, consequences, what are you gonna do about it, how are you gonna change it, right? What's the plan, right? Systematic plan. And I kind of gave a list of what that plan should look like, right, in your presentation. So for that, just a presentation is needed. You don't have to submit a paper per se, right? But as long as you're able to thoroughly kind of express what it is and what you've done, we should be okay with that. All right, so we're gonna continue talking about functional analysis, and we're gonna talk, kind of reiterate what happens in the intake process, what are some of the nuances that we need to be thinking about as practitioners, and how do we keep a good relationship with our clients, what information we have, what responsibilities we have towards our clients, responsibilities they have towards us, and responsibilities we have for whatever agency we work for, institution we work for, what have you. Okay, so in the intake process, before you begin to essentially say, yes, I will take you in as a client for your problem, right? And I'm here to solve the problem with you, help you, guide you, and hopefully we have some results. We need to have a little bit of determination, right? We need to determine, can we help this individual, right? Not every individual may be helped by us for a number of reasons. Maybe there's some other concerns outside of just an undesired behavior, right? So we need to gather a little bit more information and think about, hey, why are you here? What brought you to be here today, right? And you can say, yes, I have a bad, undesirable behavior, I have a problem, but why are you seeking help now, right? A little bit more in-depth information. Why are you seeking help now? Mom, for a child, or if we're talking to an adult, why are you seeking help at this very moment, right? So we wanna know, why are you seeking help, right? And now we wanna say, well, before we begin, we know that we're gonna have a working relationship. We have to make sure we have a good fit, that there's not gonna be any issues. Any issues pertaining to what? Well, there's a possibility that we can see that there's some sort of other immediate issues present, right? So we need to first prioritize. In my observations and conversation dialogue with this client, potential client, do I see that this person is suicidal, right? That might be outside of the realm of my expertise and control, because that's an immediate thing, and that can happen before I begin even an intake process. So do I think this individual can harm themselves? Do I think this individual can harm others, right? Are they expressing bouts of mania, all sorts of things, hyperactivity, delusions, all sorts of things, in which case they could present a harm to others, especially if they're living in an environment where there's other people around, right? Family, friends, roommates, things of that nature. Okay, and then let's say beyond that, right? Now we say, okay, we've addressed the person doesn't have an immediate priority we need to address with some other agency or get somebody else involved. Before we agree to take them as a client, we would say, okay, now we take you in as a client, right? We take you as a client, what do we need from you? Well, we need some demographic information. Right, we need to know who you are, what's your name, age, maybe marital status, right? Where do you work, what's your employment? Health insurance is a big one, most people are probably paying for the services through health insurance. Family history, right? We need to know a bit more information. Right? What does this do for us besides just having this information on record? What does it help us with? What do you believe it help us with through this process of problem solving with our client? How is this information pertinent to providing care or service or help? Yes?
So I've taken a class, can't remember the name of the class, but basically it was like intro to speech talking therapy. And we had like a whole breakdown of stuff. So in the short time you have with them, you try to get like as big a best picture you can. So you wanna get like some history, but you can't focus on that the whole time. And then you want like, actually, I guess you would do like a bunch of individual things, so like your depression, your anxiety, your use, your whatever, and then you wanna get a short history of each one of those, and then that also kind of starts you at your baseline of, that person in general, so it's like, oh, okay, where are you at now, and we start from there, and that's our, when you're trying to assess how severe things are getting.
Yeah. Okay, we say, as Will was saying, we need past and present information in order for us to help navigate the future in so many ways, right?
Yeah.
We need to know about the past, we can analyze it to see if any of this information should be categorized in some way, and for us to use it in some functional way to help this individual. Is age a factor, right? And so age can be a factor. Are we talking to a 3-year-old? Are we talking to a 90-year-old? Different physiological things happen in there, right, with the mind and the body. Maybe different environmental concerns. Maybe one person lives in a nursing home, another person may live at a nursery or with a family, right, parents or something like that, or something of the sort. Income, right? We want to know employment, income. Why is that a factor? Why is income a factor? Yes.
It's a big factor in like getting basic needs met first too, of like, hey, can we work on the big stuff, or are you homeless and do you need somewhere to live right now, so.
So once again, prioritizing. You say, well, that could be another immediate concern before I even take you in as a client. We should probably get you a place to live first, right? Or as we're working together, we should also be working on giving you some stable, sort of, money for food, shelter, everything else, right? So we're taking in all this information as part of our intake forms in order to properly assess, like, well, how do we need to prioritize before we begin? What are our priorities, right? We don't wanna be general and say, okay, let's start tackling this problem of undesired behaviors, antecedents, outcomes. We wanna say, let's understand your daily life, where you are with things, right? Where are you with everything? Okay, and so now at that point, great. Well, we have a relationship. Relationships are challenging, relationships are difficult. Typically, we listen to people we like, right? Kind of reject automatically information people we don't like. So we don't like people, it goes out of our brain and it doesn't stick, whatever they're talking about. So we gotta have a liking relationship, right? We need our client, like any other relationship, even as romantic or intimate, we say trust is important, right? I need you to trust me here. Trust me about what? Trust me that I could give you adequate information, right? That I'm a professional in this field, I've been trained, educated, so you're gonna trust the information that I give you, right? And therefore, you don't have to have anxiety about wondering about that. You wanna trust that I'm here to actually help you and be be caring for you, not be a jerk, right? Why would you wanna work with a jerk? That wouldn't be, productive just on a basic level, right, of human relationships. So you wanna smile, you wanna be caring, you wanna be nice. You want to become a friend. Because potentially this might be a very long-term or lifelong relationship. This could be someone who could be struggling with something for 10, 20 years. And now you become really a social reinforcer. You yourself, as a practitioner, are also a reinforcer, right? You can be positive or negative. So as a social reinforcer, you wanna be positive, right? So we say that individual is motivated to come see me, whatever the schedule is, once a week, once a month, every 2 weeks, every 2 months, because they like me and they see me as still somebody who can help them, right? There's still some hope. So we need that motivation there. So it's a collaboration. It's not a one direction or unidirection process, right? We're both working together. The same here at the university, right? You help me, I help you, I learn from you, right? Maybe you learn from me a little something. But this is an exchange and a dialogue. We're sharing ideas, right? The university, contrary to proper belief, you're not just taking in a bunch of mumbo jumbo. What you should be doing is learning how to think better. That's it. Nothing more, nothing less, right? And so we say collaborative. Make sure that your client knows that this is a collaborative process. Why? So that they have something valuable to add to the process. No one wants to feel like a child if they're not a child, and feeling that someone's just controlling and dictating every little nuance through instruction. Very important. Very important that we sort of present ourselves as equals amongst each other, in some sense, right? But still with the information to help. Going back to reason for seeking the service in the first place. We want to know why that happened. Did something traumatic happen? Was there a catalyst? Why now? Right? You've been having this problem 5 years, 10 years, and now you finally come here. We want to know why. Because maybe that plays, that's an important measure, because if you were actually motivated to finally come seek help, I think it's important for us to have information about what was the thing. Maybe we can use a little bit of whatever that thing was as a future motivator or reinforcer to help solve or alter their behaviors. Next, we want to inform, right? What are the policies of the agency we work with? So we get all of the administrative stuff out the way. Legal, administrative, things dealing with health, right? The health industry is huge, regulated, most part by the federal government. So we want to say also, what are our agency procedures? How does this work? Can you tell me how this process is going to work? What are some things I can't do because of legal restrictions, right? Or the agency restrictions, the company I work for, the hospital I work for, school I work for, whatever. And we want to give related services. What are some other services we also provide here? Or can I direct you to some other services that may be helpful also in this process, right? One of them, like we were saying, is housing, right? But there are places where you can help people get food, places where you can help people get maybe psychiatric medication, right? Maybe they also need a psychiatrist and need medicine as well as therapy in some sense. So we want to know related services that we can either help guide or that we provide. Then we want to express, since we're in the professional service industry, just like lawyers, right? And medical doctors, right? We want to ensure that there's confidentiality, right? Whatever happens and takes place between us and our clients, that information is private, secure, that no one will know anything outside of this relationship, right? Very important, because sometimes things are troubling. You don't know also what kind of position people are in You don't want information leaking out that can be detrimental to their lifestyle, their work, what have you. Then we want to enforce them on HIPAA, right? HIPAA is Federal Health Insurance Portability and Accountability Act. Want to make sure that, hey, you know that we're keeping records of everything about you, right? Including all this demographic information. For any other visits that you take, there will be information about you kept on record, but also that is confidential and secure. We secure it through these means and these measures. Those are federal guidelines that we have to adhere to. And we also inform them of their rights and responsibilities. Right, we let them know at any point in time if you may not want the service anymore, you feel threatened, you feel something that you have a right to in the relationship, but you also have a right if you're going to continue to be responsible and show up, right? Show up on time, kind of listen to what I'm telling you, et cetera, right? You have a little bit of responsibilities on your hand, because if not, then maybe I may pull out, right? Like the person is non-compliant or it's just not helpful, I may not be the person for that individual, and therefore we may have to end that relationship at some point, right? So that's all the major sort of administrative process doing intake and some of the pre-intake sort of information, all right? All right, now going back to functional analysis. So you're doing a functional behavior assessment. So you're trying to figure out some basic things that we've learned throughout the course of this class. We're trying to figure out, hey, what are conditions, right? So what it is we take these terms and we try to understand a little bit more about them. We say, what are conditions? What conditions? The antecedents, the things that happen in the environment that make you do something that's undesirable, right? So we want to understand that. What are your response to those things? How do you respond? What are some of the initial responses? What are secondary responses to those antecedents, right? All right, what are the consequences to that response? Or maybe even before that, we say, what is the strength of the response, right? So here we have even what we call RACS, response, antecedent, consequences, response strength. We also want to know what's the degree or strength of the response that you have for this undesired behavior that you're coming to see us with. Antecedents are important because we want to know what control does the environment have over you? And why does it have that type of control over you? So we may have to get a little more deeper about that. We may have to dig into some more source information, hence why we need this information about family history. We may have to investigate that a little bit more. One of the things I didn't mention was adding on to immediate sort of concerns before taking in a client. It's usually things dealing like if someone lives with an older person or a very younger person, there could be a threat. Child abuse and usually elder abuse are very common for someone who has, say, a really horrible bad habit, right? Alcoholism, sexual perversions, right? They're coming to see us to help them, but at the same time, who do you live with? You know, a 3-year-old, a 2-year-old with a sexual perversion, that's gonna ring the bell, right? And we said someone's probably immediately at risk and they have to call Child Protective Services, something of the sort, right? So we gotta have this information and understand the priorities of someone maybe causing harm to someone who's very vulnerable, right? Someone who's older, can't move around. Let's say anger management issues, bipolar, mania, bouts of mania, and we're someone who's very elderly, we have to figure out if they're abusing them physically, verbally, in some way. Very common, right? So figure out who's in the immediate environment too. Okay, so we say with RACS versus ABCs. Okay. So for functional, we're looking at RACS, right? So we think of, we're looking at response, antecedents, consequences, and strength. Whereas before, we kind of studied the ABC model, right, which is ABC, the activating events, or as we'll describe it as what happened, automatic belief, self-talk, right? And then we say consequences. Let's just say beliefs, let me just leave beliefs there. for B. Emotional and behavioral consequences. All right, so we're looking at something just slightly altered in some sense. So we're thinking for our functional assessment, we want to understand first, what is the response? What are the conditions in the environment? What are the consequences? What are the strength of response, right? Now we get a good idea of just the behavior itself. How strong is the behavior? What is the behavior? How do you react to the behavior? With the ABC model, which we kind of been covering all prior to now, we're looking at, well, what happened? How do you talk to yourself about the beliefs of what happened? What do you think is going on? And what are the consequences to your emotional and behavioral states, right? So I would say one's a little bit more specific, one's a little bit more generic. So we kind of get more into the details of figuring out what exactly is the behavior, how strong it is, right? Now, what can we go to in terms of interventions, evidence-based interventions, maybe using the DSM, the SCIDs, right? These interview questions that we want to have to figure out exactly how do we help this, right? What's the severity, mild, moderate, severe? What's the DSM say about that, right? How do we ask specific questions about that? What are our follow-up questions? And we can kind of gauge a little bit more insight. So here I think I have, okay, so here's an SCID for, I think I have one for bipolar and mania. All right, so we got our SCID. Remember, we're looking at interview questions, right? Kind of designed from the DSM about what we want to ask the client in order to gauge the behavior and if they're gonna meet a criteria for a diagnosis for an actual disorder, right? We can't diagnose unless we have proper vetting that meets the criteria in the DSM. If it doesn't meet the criteria in the DSM, we can't diagnose, right? We just can't. We have a responsibility towards that, right? Because we say all the evidence-based information is there. So here we're looking at current manic episodes for bipolar behavior. So we say in the last month, has there been a period of time when you were feeling so good, high excited, or hyper that other people thought you were not normal, your normal self? And now we say, hey, if yes, we're gonna have some follow-up questions. If no, there's gonna be another question, right? So we kind of separated things in terms of the response, right? So we say, if yes, what was it like? Was that more than just feeling good? So we're trying to drive a little bit more specificity in terms of the impression of the mind has on specific events, right? And it gives us information and insight into interesting, where we go from here. If no, in the last month, have you had a period of time when you were feeling irritable or angry most of the day, every day, for at least several days. Was that different from the way you usually are? What was that like? Right? And so here we say, we have A, a distinct period lasting at least 4 days of abnormally persistently elevated, expansive, irritable mood, right? And here we say, put that on a degree table, 1, 2, or 3. And what was that like? Lasting at least 1 week or any duration of hospitalization is necessary. So this goes to show you that we get pretty detailed as we go through this interview process of trying to figure out what exactly is occurring, how does it occur, what environment, what are the conditions, all sorts of things. Here, we'll read a little bit more. During that time, did you do anything that could have potentially caused trouble for you or your family? Buying things you didn't need? Anything sexual that was unusual for you? Reckless driving, right? So now we're getting to some very interesting context. We want to know a little bit about some of the normal occurrences people have when they have manic bouts, right? Bouts of mania with bipolar behavior. So if you're experiencing an episode, right, a manic episode, what happens? You get sexual perversions. Are you just randomly buying things you don't need, wasting money? Sort of self-harm in that, say, financial harm. Reckless driving, right? So in some way we could be, living like at a Kanye West or something. A manic bout. So we say except here, excessive involvement in pleasurable activities which have a high potential for pleasurable consequences, such as engaging in unrestrained buying sprees, sexual indiscretions, or foolish business investments, right? Difficult. How are we gonna work to create some interventions for this? How are we gonna change behavior on people going on buying sprees? People doing reckless driving when they go into a manic bout, right? Making foolish business investments. Our work is cut out for us. So it's not as easy as it looks, or not as easy as you think. Usually these things require months or even years of correction, depending on the severity of the issue and what the issue is, and whether that person acknowledges that they have an issue to begin with. All right, so going back, functional analysis. We're looking at specific methods used in assessment, right? So this goes to your presentations. The goal is to find controlling conditions. So if you're gonna be interviewing yourselves in a group and we're talking about some behavior we wanna change, in your presentations, I want you to kind of get deep, right? Which means, hey, these tend to be the controlling conditions according to what this person told me. So I can gather that because of these controlling conditions, there's some other stuff going on here, right? What are those things? Things to do when changing behavior, attentional condition. Only pay attention to someone when they're doing a good behavior, demand condition, what you want them to do. Well, this kind of doesn't really, let's skip that. Again, is current environment contributing to bad behavior? Think about that. Also in your analysis, are you gonna present the environment is the big factor or attributor to the behavior, or is it just the person themselves? Right? You're gonna draw some inferences to say, no, it's just the person themselves because the environments change constantly and they still exhibit the behavior. Or they only exhibit this behavior in this environment, right? I want you to kind of draw out a list to say, when does this behavior take place? And if it's multivariate environments, you have to try to figure out, well, if it's just a person, why is it just a person? Because it doesn't seem to be a controlling environment all the time. What's going on there? All right, and now we want to establish problem priorities. So you've acknowledged that there's target behavior. You look at the conditions, the environment, the consequences, and now you say, what are the problem priorities? Why is it such a bad thing? Why is this behavior a bad thing? What are the true consequences, short-term or long-term? You give examples to say, what are the direct, actual consequences? You know, I want you to tell me, whoever you're interviewing or talking to, what has happened, right? How bad is it, so we can establish priorities. What are the most severe, aversive, or negative consequences? So we wanna itemize and prioritize the consequences themselves, right? Are there a multi-list of sort of aversive behaviors or consequences? And if so, what are the lists from most moderate to severe? What would be required to handle before other problems occur, right? Can you say, well, we can't address all of these issues right now. We're gonna identify the most pertinent problems, but how we could prevent new problems from arising with whatever way we're gonna be helping this individual, right? How can we prevent some other stuff from occurring? And then prioritizing which issues could be corrected more quickly. So don't come up and just speak on a general level, talking about just, hey, it's just one problem and that's it, and this is how we're gonna solve it. Because usually it's a little bit more in depth than that, right? The priorities are a concern. We need to figure out priorities, we need to figure out which issues could be corrected more quickly, and have a systematic sort of process on how we're gonna go through all of this. And next, well, last thing I wanna talk about is controlling relationships between environments. So if it's an issue with multi-environment behavior, say it happens in usually 2 to 3 environments that behavior exhibits itself, what are the relationships between those different environments, right? So I want you to think about that too. So draw some associations, some correlations, some relationships, and how strong are those relationships with the environments that cause the undesirable behavior. All right, any questions?